All right, this foot has had a lot of surgery. So the first thing to look at would be over here. This is called a lapidus bunionectomy. It's a way to fix a bunion at the level of the base of the first metatarsal at the level of the midfoot. There's also an implant in the big toe joint. Personally, I have not really seen these two procedures performed in combination. There's a few reasons for that. Number one is the midterm to long-term data supporting use of implants for the big toe joint, which is used for arthritis. They simply just don't hold up very well over time, and it can make subsequent procedures quite complicated from a revision standpoint. The gold standard way to address arthritis of the big toe joint is simply just to fuse the joint in a good position. And one of the benefits of a big toe joint fusion is that if there's a bunion present, many times that deformity can be corrected at the same time. The long-term data supporting use of implants of the big toe joint is not very good. Many patients ultimately develop recurrence of symptoms and have to go on to another procedure. Typically what is recommended is a fusion at that point. The bad news being is that in order to get this implant in place, you do have to resect a considerable amount of bone, so when the fusion is performed, it makes it a little more complicated, and patients typically need some form of bone grafting done during that procedure. Also, recent data suggests that going from the implant to a fusion of the joint can hold anywhere from a 30 to 40% non-union rate, which is way too high. The other problem that may be occurring at the level of this joint in the midfoot is I'm not even confident that it's healed. You can still see some lucency or shadow across the joint. So if this patient were to see me in my clinic, I would start with a CT, CAT scan evaluation to get a better three-dimensional sense of what's going on. It can be a little bit challenging with an x-ray to have a true understanding of whether this is healed or not. Also, if this is healed, I'd probably remove the implant and fuse the joint.